Dr. Kyle Swanson. Hi, everyone. I'm Dr. Kyle Swanson from KSB Foot and Ankle Center, and I'd like to welcome everybody to tonight's presentation. I'd like to thank KSB and Aaron Fox for putting on this wellness event tonight as well. I do have a special guest with me, Dr. Rachit Shah. So, being summertime, um, puncture wounds of the foot can be a common condition we see. So, we'd like to have a presentation and give you some information on some of the treatments and presentation of puncture wounds. So without further ado, I'm going to turn it over to Dr. Shah.
Thank you, Dr. Swanson. Hi, everyone. Thank you for joining us for our presentation today. I'm a first-year resident at KSB. So today we're going to be talking about puncture wound. We're going to start off by defining what a puncture wound is, talk about the different types of puncture wounds we have, review the symptoms that we commonly see with puncture wounds, discuss the treatment protocols, and then lastly talk about the prevention of puncture wounds. So puncture wounds are penetrating injuries caused by a pointed object. And commonly, we notice that in the foot, especially in warm weather like today when we go barefoot. Puncture wounds are usually not the same as cuts. And most people do not seek medical attention. And this can often lead to serious infections and or amputations. So when we classify puncture wounds, we divide them up into superficial and deep. So when we have a superficial puncture wound, it's really just confined to the skin. And as it goes deeper, and if it hits the muscle or the bone, we call that a deep puncture wound. And there are various different materials that can penetrate the skin and can go deep into the muscle or bones. And the most common that you see is a nail, a screw, a broken glass, thorn, toothpicks, or a needle. This, once we have a puncture wound, those objects carry various amount of bacteria. It could be fungus, or it could be a combination of one. The most common bacteria that is cultured or observed with the puncture wound is Staphylococcus aureus. And then their most common one that is associated with the shoe wear. So if a person is wearing shoes and a nail steps through their shoes and goes into the bottom of the foot, the most common organism that we see is Pseudomonas. And there are other bacteria that are listed on the screen. The common one for a water environment is Vibrio. There can be fungus and polymicrobial, which means that it's a combination of more than one bacterium. Some of the symptoms that initially present when a patient or gets a puncture wound is pain at the site of injury. There's swelling, redness, and some drainage. And the drainage can be clear in nature, it could be yellow in nature, it could be white, milky. So it just depends on the type of drainage you have. If the symptoms do not resolve, you're looking at something more serious, and that could be cellulitis, soft tissue abscess, septic arthritis, tenosynovitis, necrotizing soft tissue infection, and osteomyelitis, which is a infection of the bone. And this varies in terms of when do these symptoms actually present. Literature says it can present as early as 2 days, and it can present as late as almost 3 weeks from the initial injury. Some of these effects, if unresolved, can be systemic, and that means that patients may spike a fever, have nausea, chills, and vomiting.
Thank you, Dr. Shah. So now we'll move on to some treatment options. In regards to foreign body removal, sometimes, as Dr. Shah mentioned, the foreign body is superficial or closer to the skin, and we can remove this in the office. Sometimes if it is deeper into the muscle or bone, we do have to go down to the operating room and perform a more invasive surgery. We also debride or clean out the bad tissue that we see and drain any abscess that may be present. Wound care becomes very important as well. Oftentimes these puncture wounds we do have to leave open and use packing, which is changed routinely until we see that it is appropriately able to be closed. Antibiotics are crucial as well. Always making sure tetanus boosters are up to date is important. And we always try to avoid amputations if at all possible. and it depends where the puncture wound is, but sometimes we do have to perform amputations. Some prevention that we can do is wearing supportive shoe wear. I know it seems kind of simple, and right now being summertime, it's common to wear socks or go barefoot, but anytime that we can have protection for our feet, that can help avoid any type of puncture wound. Checking our feet daily. If we start to notice any pain or certain areas, daily feet checks are very helpful. Wearing white socks can be helpful as well. If we have a puncture wound and we see a little red on the sock, that can be an indicator that we may have sustained an injury. And early treatment is going to be the key. So the sooner that we can address that we have sustained a puncture wound, we can treat that puncture wound and help prevent any further infection or complication. So our wound care center, if anybody does sustain a puncture wound or any type of wound, we do have a wound center that's located on the annex first floor of KSB. We do have a team of providers, and our main goal is to provide a comprehensive approach to healing and keep you on your feet. Our contact information is there as well, and we'd be more than happy to assist you in any wound care. So in conclusion, puncture wounds are commonly seen in our everyday practice and daily work. It is important to identify clinical features, symptoms, and how patients are feeling to provide the correct treatment. We need to obtain a proper and thorough history and physical, and always keep in the back of our mind making sure that tetanus booster is up to date. Puncture wounds with any signs of infection, we need to make sure that we're involving antibiotics, debridement, or cleaning up any bad tissue, and hopefully we can avoid any type of amputation. Once again, early treatment is key. So that's our presentation tonight. We hope that you were able to learn something about puncture wounds and found our presentation helpful. And so we'd like to wish everybody a safe and happy rest of your summer, and we'll see you next time. Thank you.